Thank you very much for the opportunity to share this case, but I will just make it very brief. This is a patient, a very young patient, a 37-year-old gentleman who had a triple vessel disease, meaning that all three major coronary arteries have significant narrowing. He has diabetes, no family history of heart disease, is not a smoker. And as we all know, diabetes has a higher risk of developing coronary disease, and young patients have higher chance of requiring a repeat procedure in the future. And if we can put in an implant that can subsequently uncage the vessel without uh, adversely affecting the function and the vasomotion of the blood vessel on a long-term basis, it will be undesirable. Next, yeah. So for this particular patient, yeah, we two DynamX bioadapter were implanted to open up the coronary arteries for blood flow to the heart. One is in his left anterior descending artery, another one in his circumflex artery. And patient is doing well and has been discharged from home. This is the picture before and after the implantation of uh, m- the bioadapter DynamX in his left anterior descending artery. And the next slide will show the picture before and after. Yeah, he has this narrowing here, and this is after. Yeah, so the implantation process, as mentioned by Jack and Professor Antonio Colombo, is exactly the same, like the metallic drug-eluting stent. Next slide. Yeah. It, and it is easy for physician to use. We need not change the implantation technique. The handling characteristic of this bioadapter is similar to most of the metallic drug-eluting stent being widely used in the cath lab now. This is unlike the previous technology of bioresorbable scaffold, where some of the implantation techniques need to be modified and the device tend to be bulkier. So the acute performance of this bioadapter is the same. They are very deliverable, uh, uh, very conformable, and with good expansion limits. And it also provide very good radial strength to support the vessel expansion. And this particular patient will be followed up to see the result of uncaging. Next slide. So this DynamX is really a promising new stent platform that potentially addresses both the short-term and the long-term needs for treating the obstructive coronary narrowing. It has very appealing concept of the uncaging of the blood vessel, allowing positive adaptive remodeling to potentially accommodate for the future progression of the atherosclerosis. It allowed the restoration of vessel cyclic pulsatility and also allow some return of the blood vessel to the original curvature. So there is theoretically there's also a less than fractured. Yeah. However, we will need more data to prove the superiority over current generation of drug-eluting stent. But the 24-month result presented by Professor Colombo is very promising and encouraging.